what I brought with me this year at ESOC is that there's been a lot of talk the past year about biases in machine learning. So is it biased towards, for example, recognizing men over women? Is it biased towards recognizing young over old? So we looked into that in a separate analysis. And what we found was that the call handlers had an innate bias themselves. So they recognized men better than women, and they recognized old better than young. We looked into, well, how does the machine learning algorithm do? And it inherited some of the biases in that it still outperformed on men versus women, on old versus young. But what it did was it bridged the gap somewhat. It improved more on women than it did on men. And it improved more on the young than it did on the old. So it actually eliminated some of the biases. While inheriting a little bit of it, it helped to reduce it. Sadly, we didn't have data on ethnicity or race, which we would really have liked to look into, but that wasn't registered in our registry. So that could be another thing to look into. But I would expect we would see the same, that if there is a bias, the algorithm will inherit some of it because it uses that as the training data, but it will help bridge the gap and have less bias if used in conjunction with the humans triage.